Welcome back. March is International Women's Month, and this morning we're highlighting an important but oftentimes confusing topic, hormones and how they relate to cancer risks in women. Here to help us better understand this is Dr. Christopher McCann with HCA Florida Healthcare. You know you practice the names when you get on air. Welcome. Thank you so much for being here. So which gynecologic cancers are considered hormone driven?
Yeah, so in the gynecologic cancer world, the most common hormonally driven cancer that I treat is endometrial cancer caused by estrogen exposure.
Okay, and so how does estrogen play a role in that? And what does a lifetime exposure to estrogen look like with early periods and late menopause?
Yeah, so estrogen exposure without the correct balance of progesterone can lead to an overgrowth of the lining of the uterus. And with that overgrowth, then abnormal changes can take place within the lining of the uterus that then leads to a cancer. And so as women are exposed to estrogen throughout their lifetime, that increases their risk. So some examples for increased exposure would be if you started your periods early, if you went into menopause late, pregnancy, or if you don't ovulate every month, in syndromes like polycystic ovarian syndrome. Those are all examples where you would have increased estrogen exposure.
Okay, how do you know if your levels are, in balance, if they're too high, and how do you course correct that?
Yeah, so there isn't really any testing for hormone levels. Essentially, your body will regulate your hormone levels. And in some cases, when you may not be ovulating every month, it'd be important to see your gynecologist to talk about birth control, because that can sometimes help regulate those hormone levels.
Okay, so many women still worry that hormone replacement therapy causes cancer. What does the latest evidence actually show?
Yeah, so in the gynecologic world, it's kind of a difficult question. There are two types of hormone replacement. So there's combined estrogen and progesterone, and then estrogen alone. And in the combined estrogen and progesterone group of patients, there really isn't an increased risk. It's when you give estrogen alone to a intact uterus that can cause increased risk. Traditionally, there'd been a lot of warnings about hormone replacement. More recent studies, suggest like in age 50 to 59, so what we consider early menopause, that it's actually, those risks are minimal as opposed to patients who are over 60, so we don't worry as much anymore.
Okay, well, considering all these things, if someone is concerned, when should they see a specialist?
Yeah, so in my world, any postmenopausal female who has abnormal bleeding, and that doesn't mean a full period. That could mean spotting, that could mean a full period, but anything postmenopausal is not normal. So that would be definitely sometime that you'd want to see a specialist.
Okay, that's good to keep in mind. Thank you. And then if you could leave women with one key message about hormones and cancer prevention, what would it be?
I mean, the big thing is listen to your body. Pay attention to symptoms. Try to maintain a healthy weight. And get your screening done, and that's going to be the best way to take care of your health.
And how often do you recommend, just really quickly, those screenings?
Yeah, so you should see a gynecologist once a year. There are various guidelines around getting pap smear screening, and those guidelines change based on age, but you should still see a gynecologist once a year.
Okay, Dr. McCann, thank you so much for being here.
You.
This is all really important and useful information, so I'll make sure that we have this interview online on WPBF.com. You'll also be able to access it via our free WPBF 25 News app, because awareness is key. Thank you again, Dr. McCann.
Thank you.
Stephen